When I was in medical school, they taught me that the normal blood pressure was 100 plus your age. Things have changed. We used to call it essential hypertension. Have you ever heard that? The reason it was called essential hypertension was because they believed that hardening of the arteries was normally, it was a normal part of aging. And as your arteries got harder, you needed a higher blood pressure to get the blood through. But now we know that's not true. And in many societies where they stay very active and eat better than we do, the blood pressure does not go up with aging. I worked for a while in 1998 in Nepal, and the entire time I was in Nepal, which was 3 months, I only saw one case of blood pressure that was over 120. And I saw 60 patients a day for 3 months, and only one person had a blood pressure over 120 to 130. And where was he from? Well, he had spent most of his adult life in the army for the British. He was a Gurkha, and so he had been exposed to different food. What do they eat? Rice and beans, basically. They call it dal bhat. It's lentils and rice. And if you have that 3 times a day, which we did for 3 months, your blood pressure goes down. And you don't even get excited at mealtime. What are you going to have for lunch today? Dal bhat. What are you going to have for supper? Dal bhat. What are you going to have for breakfast? Dal bhat. But your blood pressure stays good. So we know now that ideal blood pressure is less than 120 over 80. You heard me, less than 120 over 80. In fact, if you look it up in the most recent articles, they say the ideal blood pressure is 110 over 70 or less. That's low. If you come into my office and your blood pressure is under 140, I'll say, well, that's a pretty good blood pressure. What do I mean by that? What I mean by that is I don't have to increase your medication. Now wait a minute. I just said your blood pressure is normal if it's 110 over 70 or less, and you come in and I don't do anything if it's not over 140. Why? Well, because there's side effects to medication. And so you don't want to treat with medication all the way down to 110, because then people will be passing out and breaking hips and doing other things that isn't nice. And they won't like that. But if you can get your blood pressure down naturally, it's good to take it down to 110 over 70. Not good to get it there with medication, however. So, as I've said there, for every 2 points the systolic blood pressure exceeds 120, the risk of stroke is increased by 15% and the risk of heart attack goes up 10%. So by the time you get from 110 up to, or 120 up to 140, where I'm going to start using medication, you're already 20 points high. Divide that by 2, because for every 2 points, that's 10 times 15, or 150% increased risk of stroke and 100% increased risk of heart attack. So that's why we treat it, even though the medicines have side effects. Another thing that's important is having an elevated blood pressure in midlife, that's 40 to 60 years, conveys a greater risk for dementia than having the genetics for Alzheimer's. That's the APOE4 allele, the so-called Alzheimer's gene. Worldwide, what? Yeah, it's right in your handout.
Oh, okay.
Just read it there. Okay, APOE4 allele for Alzheimer's. Worldwide hypertension is the #1 underlying cause of premature death. If we could normalize everyone's blood pressure worldwide, we'd save more lives than anything else we could do. Do you know what the #1 dietary thing is that we could do worldwide that would save more lives than anything else? No, it's not eliminate meat. No, it's eat more fruit. Yeah, eat more fruit. And I love that because I love fruit. Blood pressure is the #1 health problem in our world. All right, what are the causes of, yes?
I just wanted to ask about the diastolic blood pressure. Is any of this?
Diastolic is important, no question about that. Systolic is the most important, particularly once you get to middle age and beyond. But diastolic is important. You want to keep that at 80 or below. Once you get up into the 100 and 110, then that conveys increased risk as well. But if you bring the systolic down, the diastolic almost always comes as well. Now, as I mentioned, we used to call it essential hypertension. Now we call it primary hypertension. There are other causes of hypertension, secondary hypertension. They're very rare, less than 5% of hypertension. Those are kidney problems, adrenal problems, narrowing of the aorta, coarctation it's called, but we won't cover those tonight. We're going to just talk about primary hypertension. And the causes of that are high sodium, low potassium, inflammation, obesity, high insulin levels. Insulin increases sodium retention, and it increases your blood pressure as a result. You don't want a high insulin level. How do you know if your insulin level's too high? All you need to do is look down, and if you can see your belt, your insulin level's pretty good. If you can't, and I had to, crane a little, then you know your insulin level's higher than it needs to be. Your waistline is the best indication of your insulin level. If your waist is larger than your chest and hips, we got trouble. Your insulin level's too high. So you want to work that down. Excess sugar. We talk a lot about salt. Sugar probably causes as much or more high blood pressure than salt does. It's the other white powder, and you want to keep that down. Excess stress. If someone came in here and shot me and then said, I'm going to finish my job, but first of all I want to measure your blood pressures, where would your blood pressure be? It'd be through the roof. Now, of course it should be, because immediately if something like that happens, your epinephrine goes sky high and you're ready to run or fight or something, and your blood pressure goes up when that happens. And the only problem is, if a bear came in here, we'd all run, but if someone came in here and started arguing and getting you riled up, you shouldn't punch them out in a civilized society. And so that epinephrine, instead of getting burned off with exercise, turns inward on you and your blood pressure goes up. So, if you can't fight, you got to exercise, and it's not good to fight in our world, so we need to exercise or work. Come help me split wood. I've got a lot to split, by the way. And then inadequate sleep. Did you know that before the invention of the electric light bulb, the average American slept 10 hours? And in 1950, we had that screen come. It was called TV, and we not sleeping as much. And 8 hours was in 1950 the average amount, and today the average amount of sleep that a person gets is about 6 to 6.5. High blood pressure. You can do that with sleep apnea too. Sleep apnea causes hypertension because you're not sleeping well. Sleep is very important. All right, so how do we reverse hypertension naturally? Well, you're going to have to deal with those causes, right? So that's what we're going to look at next. Number one, lower your sodium intake. The average intake is about 3,400 milligrams a day, some more, some less. I've seen people that were taking as much as 10,000 milligrams of sodium a day. The recommended amount is about 2,300 milligrams, which is 1 teaspoon of salt. And that's not much. You can get 1 teaspoon of salt pretty easily. Why is salt bad? Well, several reasons. One, if you have a lot of salt, anybody get swollen ankles from eating a lot of salt? Some people do. Why? Well, you retain fluid. And not only do you retain fluid in your ankles, you retain fluid in your blood volume. It expands the blood volume. And if you have a higher volume in a confined space, what happens to the pressure? Goes up. So that's one of the ways that salt raises your blood pressure. The other way that salt raises your blood pressure is because it has an effect on the endothelial cells that line the blood vessel. It stiffens them or hardens them. And if you can think of yourself inside the heart riding in the blood, if you get shot out of the heart with the blood and you hit something hard, that's going to have a higher pressure, right? Let me give you an illustration. If you and I all stood up and we jumped on this floor, we'd have a sudden stop and there'd be a lot of pressure in our feet and in our knees. But if I brought in a nice big trampoline and we all jumped on it, we'd go down and then up and there wouldn't be much pressure at all. If your blood vessels are nice and relaxed and stretchy, which they should be normally, your pressure drops. But if they're hard, there's higher pressure between my fist and that wall than there would be if there was something stretchy there and I hit it, like some spandex or something. You hit that, the pressure wouldn't be as high. The other thing is if the artery is distensible and stretchy, it also pumps blood. When you hit that, if it was spandex or something elastic, you'd hit it and it would rebound. And so when the heart pumps blood, if your vessels are relaxed, they expand, the valve to the heart shuts, and then as they contract back, the blood vessels, the blood is pumped on down through the arteries. And it reduces the workload of the heart if your blood vessels are soft. And sodium causes the blood vessels to be stiff. Some of us are much more responsive to salt than others. And some people can eat a lot of salt and their blood pressure doesn't go up. Others eat a small amount and their blood pressure shoots quite high. But it affects all of us to some extent. Now, the next thing that I have there, number 2, is if you are overweight, lose weight. You can have high blood pressure and be thin. And you can be overweight and not have high blood pressure. But for any individual, as they lose weight, their blood pressure will come down. It won't keep falling, don't worry. If your blood pressure's normal and you're overweight, you can lose weight and your blood pressure won't go below where it needs to. But the reason that your blood pressure comes down if you lose weight is because every pound of fat you have, there's a mile of blood vessels. So your heart has to do a lot more work, right? And it has to pump harder and your blood pressure goes up. So as you lose weight, the blood pressure comes down, and that can be very helpful to you. Another way to lower your blood pressure is to exercise. Why? Because exercise helps the arteries to stay distensible, stay elastic. You know, your body's not too much different than a road department in a town. If we went out here to Main Street and we tripled the traffic on the road, what do you think Brunswick would do within 3 or 4 or maybe 10 years? They'd improve the road, right? They'd widen it and they'd improve the surface. Your body does the same thing. If there's increased traffic in your blood vessels, that is, you're pumping blood around more, and because you're exercising, the body says, well, traffic's increased here, we better widen the roads. We better make them more, ready to accept this bolus of blood that's coming out. And your blood vessels actually improve in their distensibility and their elasticity, and as a result, your blood pressure drops. What kind of exercise do you need to do that? You need aerobic exercise. The best is walking or jogging or swimming or riding a bicycle. The best is not resistance exercise and weight lifting, because actually your blood pressure goes up a little bit when you're using your arms and tends to drop when you're walking. Doesn't mean you shouldn't lift weights, you should, but if you have really high blood pressure, don't start with that. Start with walking, jogging, swimming, cycling, more that type of exercise. All right, get more sunshine. This is the one I like best. If your skin can handle it anyway. Sunshine releases nitric oxide. What's nitric oxide? Nitric oxide is a chemical that's made by the endothelial cells, and as they make it, it relaxes the smooth muscle in the arterial wall. You see, arteries are not fixed pipes. They have the ability to distend and to contract. That's very, very important, because if you just sat down and ate something, the blood flow to the gut increases. If you sit down and you look at a picture really closely and you're looking at it detailed, the details there, like this lovely sweatshirt here from the Common Ground Country Fair. It's, I'm looking at that, it's a great thing. Immediately as I'm looking at that, the blood flow to my occipital cortex that I actually see with can go up by as much as 200%. And the arteries, in order to do that, have to dilate to allow that to happen. And then if I do a mathematical calculation here, the blood flow shifts from there to the front of my brain where you do math with. If you're listening to your wife, it's going to increase, gentlemen, on the left side of your brain. If you're listening to music, the blood flow goes over to the right side. And if you're doing curls, the blood flow is going to increase in your arm. And you want that distensibility to the blood vessels, and what mediates that is nitric oxide. If your nitric oxide level is higher, your blood vessels will be more relaxed. And so it's really important that we get that nitric oxide. And one way that we get that is when we relax in the sunshine. Another way that we get that is by eating that potato salad. Why? Because it has beets in it, which are rich in arginine, which is a precursor of nitric oxide. And a little bit further down in your handout, you'll see some foods that increase nitric oxide. But I have some there as well. Spinach does, arugula does, beets, pumpkin seeds. Citrulline is also a precursor for nitric oxide, and watermelon, cucumbers, and other melons are rich in citrulline. I have several patients who don't tolerate medication well at all. I think of one elderly lady. I've tried, 30 different medicines on her. None of them work well, so I said, well, just eat watermelon. And she's found that if she eats about 6 cups of watermelon a day, her blood pressure's fine. She went to the store in the winter time and asked for watermelon, and the guy there said, watermelon is really expensive this time of year. Don't you want to try something else? She said, well, it's cheaper than dying. And there you go. So, but there are other foods that you can eat that will give you nitric oxide. It's very important to relax your blood pressure or your blood vessels.
Question about spinach.
Yes.
You have to cook it first. Is it better cooked?
You can cook it first. You get a little more arginine, but you can get it from raw as well. Beets, the interesting thing is a lot of athletes are using beets and beet juice. The reason is their blood flow is so much improved by that their athletic performance improves by about 5%. Now, if you're a highly trained athlete and you get a 5% bump, if nobody else is drinking beet juice, you've just won the race. And so most Olympic athletes are onto beet juice and drinking a lot of it. But we found that beets work just as well as the beet juice, and so eat the potato salad. Yeah, so there it is. All right, another thing that you can do is you can reduce inflammation. And number 6 there, it says eat flax seeds daily. Well, you could do something else. You could eat chia seeds. They're pretty high in omega-3 fatty acids as well. The one study that was done showed that if you have 2 tablespoons of flaxseed a day, you get about a 10 to 15 point drop in your systolic blood pressure and a 7-point drop in the diastolic. For the best effect, you want to grind those seeds so you absorb the omega-3s. But it isn't just omega-3s from flax. You also get fiber. Fiber also reduces inflammation, and it will reduce your cholesterol, and it will lower a man's risk for prostate cancer, and it will lower a woman's risk for breast cancer. So flax does a lot of good things for you, and I'd encourage you, if you have cardiovascular risk factors, to get used to using flax and use it regularly. The other thing it'll do, it'll improve arthritic symptoms. So it's sort of a miracle food, and it's not too expensive. That's the nice thing. If you do use the seeds, use them ground, and either grind them freshly yourself, or if you buy ground flaxseed, keep it in the refrigerator so it won't go rancid. Number 7, reduce or eliminate alcohol and caffeine. Both of those will raise your blood pressure. Chocolate is an interesting thing. Chocolate is rich in polyphenolic antioxidants, and you'd think it would lower the blood pressure, and quite a few studies show that it do, and equal amounts show that it doesn't. And the reason is because it contains caffeine and theobromine. So it's sort of good and bad at the same time, but it doesn't have a negative effect on the blood pressure. So if you're going to have something, enjoy it and don't worry about your blood pressure. Except if it's milk chocolate and has a lot of sugar. The best is the extra dark, semi-sweet, and that's what I like the best, so you can enjoy it too. Reduce or eliminate animal protein intake. Why is that? Well, animal protein is very hard on the kidneys. I often talk to my patients that have kidney problems and say, rather than going on dialysis, would you like to try going on a plant-based diet? And what I found is that many of the patients, if they'll eliminate the animal protein, their kidneys respond well enough that they can stay off of dialysis for quite a while, if not permanently. They just have to be careful because of the acidic nature of animal protein, higher in sulfhydryl groups, and that's hard on the kidneys, and as a result your blood pressure goes up. Even though they didn't find that in the Annals of Internal Medicine study, it's still true. All right, drink water. Why drink water? Because water washes sodium out of your body. One of the medications that we use for high blood pressure is diuretics. You've probably heard of those. Well, how do they work? They cause you to excrete sodium from your body. You can do the same with water. If you drink enough water, your serum sodium will drop, and that's one problem in the very elderly. Sometimes they lose the ability to concentrate their urine, and I have to tell them, no, you're drinking too much water, your serum sodium's too low. But usually, with normal kidneys that concentrate the urine fine, you'd have to drink about 3 gallons of water a day to lower your serum sodium. That does happen in a condition called psychogenic polydipsia. That just means you're crazy and you drink too much. And I don't recommend that, but it's easy to diagnose because when they stand up, they pass out because their blood pressure is so low from drinking too much water. I don't recommend that. And be careful, 6 to 8 is plenty unless you're sweating or running a marathon. I had a gentleman in my office yesterday that was running his 21st Ironman, and he happened to be running it in Chattanooga, and the temperature was 96 degrees and the humidity was about the same, and he just tanked. He got dehydrated. He didn't get enough water and enough salt. In that case, you have to do both. But most of us aren't running an Ironman. That's a full marathon and 120 miles on a bicycle and swimming for I don't know how long, but a long time. How old was he? 56. Yeah, amazing guy. So number 10, reduce your intake of refined sugar to lower your level of advanced glycated end products, which elevate blood pressure by stiffening the proteins in your blood vessels and your red blood cells. I've talked about this before. But when we have a high sugar diet, sugar attaches to the cells irreversibly, and when it does, it stiffens the protein. And remember that the average red blood cell is 7 to 8 microns in diameter. They have to squeeze through capillaries 3 to 4 microns in diameter. The only way you do that is to squish the red cell. And if it's stiff, the only way you can push it through there is to go raise the blood pressure. So sugar will raise your blood pressure quite nicely. All right, 11, increase your intake of potassium. Most of us aren't eating too much sodium, we're eating too little potassium. You really want to balance there, and if you increase your potassium from the 2600, which is the average intake, to 4700 milligrams of potassium, it makes a real difference. And the best way to do that is to try to get 1 or 2 high potassium foods in your meal at every meal, and that gets you there easily. Fortunately, foods that are high in potassium most of us like, and that's potatoes. White potatoes, sweet potatoes, winter squash are all very high, and I have some potassium-rich foods there on the list as well. Lastly, you can try controlled breathing. This is one of my favorite because it's so easy, and you get credit for doing nothing. You can just sit there and relax while you do your breathing. This will work before the doctor comes in to take your blood pressure. What you do is you just take a deep breath in through your nose. Why do you take it in through your nose? Because when you breathe and air passes through the nasal passages, your body automatically increases nitric oxide. And then you blow it out through pursed lips, and when you do that, you increase the oxygenation of your blood, and that relaxes you as well. And so if you slow your breathing down to less than 10 breaths a minute, and most people can very easily slow them down to 4 or lower, I'm very comfortable with 2 breaths a minute. They're deep breaths, but if you do it, it works great. So you can all do it with me now. So we'll breathe in through our nose like this. Purse your lips and breathe out like this. And you can see why I can give lectures, because I have a lot of hot air. You know, it develops your lung capacity too to do that. But you can slow your breathing way down that way, and you can relax while you do it. And if you do that for 15 minutes every day, your blood pressure significantly drops. The study that I reviewed showed that the average person dropped their blood pressure 10 to 15 points. That's more than a medication. So instead of taking the pill, just breathe like that and skip that one maybe. It's worth a try anyway. It won't drop your blood pressure too low, but it will bring it down toward normal. All right, so then I have some lists of food there, and then we'll open for questions. As I mentioned, fiber lowers inflammation, it lowers cholesterol, it reduces your blood sugar, it aids in weight loss, all of which lower blood pressure. Chia seeds is 34% fiber. What does that mean? Well, it means you have 34 grams per 100 grams of chia seed, or 34 grams of fiber per 3.5 ounces. So that gives you an idea how to convert that if you want. I also have it in cups. If you want afterwards, I can give it to you in that. But it's hard to compare foods because you certainly aren't going to eat as many chia seeds in volume as you will an apple. But it gives you a rough idea. Flax is 27% fiber, almonds 12.5, oats, they're really wonderful. If you have high blood pressure, eat them every morning or whenever you wish. Just keep the salt low in them. Split peas are high, lentils, avocado. Raspberries are the highest fruit. Raspberries are really interesting. You can eat them and they'll actually lower your blood sugar after a meal, even though they have sweet in them. They're very interesting. They're good for preventing cancer. They lower blood pressure. Any of the berries are fine, but raspberries win as far as fiber. And then you have the beans there as well. Pears are rich. Then you have beets, bananas, broccoli, Brussels sprouts, apples. You can't eat too many apples. Well, I guess you could, but it's hard. Foods which elevate nitric oxide levels you have there. Beets, leafy greens, watermelon, garlic. Garlic does it not because it has precursors, but because it helps prevent the breakdown of nitric oxide, so it raises the level that way. And then some potassium-rich foods. Potassium does just the opposite of sodium. It relaxes the endothelial cells and blood vessels and lowers the blood pressure. So there's some high potassium foods. You can go online and look those up as well. Any questions? Yes?
Where do you get the handouts?
Where can you get the handouts? I can give you mine, or someone can copy one out. Well, copy a different one. This is in larger print. But hey, now she's got one. Okay, we're going to make some more copies. Next question.
Is there a blood pressure? What is it like if your blood pressure is too low?
Your blood pressure is never too low unless when you stand up, you're lightheaded and dizzy and pass out. Then it's too low. 90 over 50 is fine with me if you don't have symptoms. And if your pulse doesn't go up when you stand up. The pulse goes up a little bit, but if you check your pulse when you're sitting and then you stand up and your pulse goes up just with standing by 10 to 15 points, your fluid level's low and you need to drink more water. Get that up. But 90 over 50 is fine. That's not high. We're just not used to normal blood pressure.
Can you speak to heart rate in connection to blood pressure?
Yes, I can. Blood pressure is actually two things. It's cardiac output times the systemic vascular resistance. And cardiac output is heart rate times stroke volume. So the higher your pulse is, heart rate and pulse are the same thing, sorry. The higher your heart rate is, the higher your blood pressure is going to be with the same systemic vascular resistance. That is, how much clamped down your arteries are. Now here's another thing, I didn't put it on here, but I should tell you. Many of us dress in such a way that our blood pressure is higher than it needs to be. How's that? Systemic vascular resistance, that's the tone in your arteries. And if you stick your hand in hot water, what happens to the arteries and the blood vessels in your hand? They dilate, right? Okay, so if you go out in the winter and you have a vest on and your arms are bare or a skinny shirt and you have a coat on but your pants are just one layer, your blood pressure is going to be higher than if you put the same layers on your arms and legs as you do on your chest. Because your systemic vascular resistance will be lower if you keep your extremities warm. Because if you're out there and you're shivering and your legs and arms are cold, the blood vessels are constricted trying to keep you warm. Now in the summer, fine to go out shorts and a tank top because you're hot and your body's trying to cool itself, and so the arteries are dilated. But if you're cold and you don't dress properly, your blood pressure will go up. So if you want to see what I've got on, if I wear a t-shirt, what does it have? Can you see? Long sleeves. Why? I want to keep my SVR low. So I practice this stuff. Yeah. If you wear a short sleeve t-shirt, your SVR will be slightly higher than if you wear a long sleeved one. I'm always trying to cover my extremities the same number of layers as my chest. So in the winter, if I'm going out in the cold, I'll wear lined pants before I'll put on a heavy coat. And if you have lined pants and a wool shirt, you'll find that you can go out in a hat and good gloves. You'll find you can go out in cold weather and not need that heavy coat. And if it's really cold, then you put more layers on, but you want to try to keep the chest equally covered with the extremities. And your blood pressure will be lower, and you won't mind the cold as much. Remember what they say, no such thing as bad weather, just poor clothing. All right, so that's SVR. Any other questions? Yes?
I sweat profusely from my head when I get physically active. Does that have to do with blood pressure?
No, that has to do with heat. You sweat profusely because you're warm. And if you're really warm, then you need to dress down a little bit. And you won't have to worry about your blood pressure as long as you are equally clothed. Yeah. And you can get too hot and sweat just sitting still if it's hot enough. Yeah. Question? Dried prunes? Fine. Enjoy dried prunes. They're rich in potassium. They're high in fiber. They are sweet, but they're high in fiber. They're about, I forget how many calories per pound, but around 2,000, so you can overeat them. But they will keep you regular. That's okay too. Other questions? All right, one more. Okay, so what about Tai Chi and some of the Oriental exercises? They're fine for blood pressure. They're relaxing and that helps, but there's nothing quite as good as vigorous physical activity to lower blood pressure, especially if you enjoy it. Walking with a friend is great, and I recommend instead of slowing down when you come to a hill, you speed up. And that really gets you going. Yeah. It's called interval exercise.